our problems for the NFL retirees is that as a population, we are 50 times more likely to have things like dementia or Alzheimer's disease, and particularly a Michigan study says it's even worse for NFL retirees, the younger guys we were just talking about, ages 30 to 49, who are 19 times more likely than the average male to suffer from these kinds of problems. In 2003, the United States Department of Labor reported that the NFL injury rate is 8 times higher than any other commercial sports league. Many of these injuries linger long after a player's NFL career has ended. And this is kind of the problem. You know, when guys try and go in and get benefits, it's not right after their playing days. These things develop or come later on. And a lot of times when the players don't have the support or the financial wherewithal that they might have had during their playing days or shortly after their retirement. The thing that I would like to go back to and to say is that no matter which way you go, whether it's the alumni or whether you go with the Players Association, you still have to deal with the NFL. And the NFL really is the only game in town. The NFL has all the power all the time. And since there is no competition, you don't have any leverage. You can't do anything. So you're always bargaining with the one and only NFL. And so if you do not like it, you don't have any other options. There's really nothing else you can do. It's still their ball, and no matter who comes to the table, you're going to play with the NFL ball. What the RPA is all about is let's have some leverage there. Let's bring some new players to the table. Let's kind of even this whole thing out. And I think it's a great opportunity to do this, and it's a great opportunity to talk about this because the collective bargaining agreement will come to a hiatus where there's actually no bargaining or no contract on the table, which simply means all things are open. When I speak of the current league and the current Players Association, I think that there are things that what I hear DeMaurice Smith, what I hear the players talking about, some of them concern us, but a lot of them don't. I also think the nature of the league, the game, not necessarily the game, but things like media, all of these things, those kinds of contracts are going to be so substantially different that I believe that there are literally billions of dollars on the table that they are not currently in the process of negotiating. Right now, the game of football is the most popular sport of all the sports in the United States. This particular game on Sunday, they're expecting to generate over $200 million in ticket sales and concessions alone. This is not the key TV contracts. I mean, just imagine the kind of money that we're talking about. It's unimaginable. That money is going to get more lucrative, better. The NFL, you have to remember, has their own network. When I talk to CBS guys or Fox News or ESPN, these guys think that the NFL will handle the majority of all the TV exposure. When you get to the NFL and talk about the monies that are on the line, where do the retired players come in? You know, as it stands now, we have no leverage, no negotiation, but yet and still getting back to the history of the game, the founders of the game, the guys that built the game, we are being used consistently, even in today's game with the Packers and the Steelers. The history of the game, they go back, they reflect on games like a Jim Taylor or a Mel Renfro, Marv Fleming, Dave Robinson, and certainly in a lot of cases, the Carl Eller. But the point is that whenever they use that, we are not compensated. So it's an opportunity to look at those kinds of things. What I am really here today to talk about is what the real concern of the current retired player is, and that is SecuriCare. And what SecuriCare is, it's a network of clinics and hospitals, and we're developing partnerships with the great institutions in the country, some of the best. Mayo Clinic, Johns Hopkins, and Scripps University. And the idea is that SecuriCare will provide the retired NFL players a cohesive, easy-to-use network of thousands of expertly trained and skilled medical professionals. SecuriCare is a prestigious healthcare network, and which is quite possibly, and certainly in my opinion, one of the world's best. But also in my opinion, I think that we have done better, even with our own meager resources, than the Players Association or the NFL in terms of helping players and providing benefits. Some of our leaders will come to, but our leaders come from this national network of the highest quality health care, and the idea is to make this available for all of the retired players. What I hear from other retired players is when they talk, well, you guys, the Hall of Famers, you get all the benefits, you get all of this stuff and stuff like that. What about us guys? What about us lowly peons, as they refer to themselves? I've heard these guys talk. I remember talking to one player, and he says, well, I was really happy when I heard about Paul Krause and how small and how little his pension check was. You know, and he says, well, because I felt like I was the only one that was out there that was drawing this kind of a salary. And the truth is that there are a lot of guys out there, but they don't know each other. And what I'm referring to is the players, when I played, a lot of them were encouraged to withdraw their pensions early, which means you got a reduced pension. If you fast forward 20 years later, you know, it's a few $100s, $500, maybe $600. Compared to what these guys get today, it's thousands and thousands of dollars. So, you know, there's a whole truth kind of thing that guys are reflecting on that says, man, you know, I need help, but where do I turn and where do I go? Here are some of our leaders, Dr. Patricio Reyes, and we will talk with him later. We'll bring him up. I will have a phone call, a conversation with him. Now, I've gotten to know Dr. Reyes simply because that he is one of the leading persons in particularly brain trauma and head trauma, brain injuries. He is a neurologist and a neuropathologist at the Regents Hospital in Minnesota, and he's presently the director there. But he has been a pathfinder in terms of brain injuries, collecting the brains and researching. In Minnesota, they have one of the oldest brain banks and one of the largest brain banks, and he is the director of that. More importantly, he has been an advocate for identifying as well as improving the healthcare needs of all ethnic groups and high-risk populations. He was a volunteer physician for Golden Gloves, and he's worked with boxers who, these guys are known for having their head injuries and the trauma, those kinds of things. Another advocate and one of our leaders is Dr. Laura Aberton. She's at Scripps Hospital, and she is on a group that provides sports care for some of the sports teams in Southern California. She has been a great advocate for us, kind of been a leader in us getting some of the other institutions on board, and we're very proud and very happy to have her, and she's an inspiration for us. Another gentleman is Dr. Jack Burt. Now, he's an orthopedic. He's a great speaker. He goes out and he does a lot of a talk about the particular care that the athletes get. And he's the head of what they call ON, which is Arthroscopic Association of North America. These are basically the guys that provide all the knee surgeries and shoulder surgeries around the country. And this organization is about 3,000 members. We may be able to get him on the phone with us too later today. But this gives you some example of the quality and the type of people that we have, and also the coverage that we have. This is a very comprehensive network of professionals, and we are the only organization that's really put something together like this. There are bits and pieces. You know, the NFL keeps adding bits and pieces of different programs, and these guys come up with these kinds of things. But we have put this together. Our organization has been able to put an organization together where we actually help people. Players have access to us. We have helped approximately 500 players, and what we do is we provide them total access to health care. These assessments and evaluations are expensive because they get evaluated totally, from the, head to toe. They do the orthopedic stuff, they do the cardiovascular, internal medicine, and also they do the brain, the psychoanalysis, the mental analysis, including, any brain damage, concussions, and things like that. The other idea is that we want to talk to players, current and past players. We want to talk to the fans. We try to get input from all of these people. We want to include people. That's why we want to include these other organizations. They have great strengths, admittedly, but the point is that they have not been able to put together a complete care system for the retired player. And by that I mean where they have easy access and total care, but also total quality care. Health care is a matter of life and death for retired football players. Players that made the game of football what it is today, these are the guys that paid the price, financially, physically, and mentally. Those players who have suffered career-ending injuries, who suffer with the pain and trauma of those injuries daily. It is for these individuals that the Retired Players Association is able to announce SecuriCare. I want to go back and say it's not just for the old guys. Guys are ending their careers today. I mean, a guy could have an injury, his career could be over, today. Some of these guys that may play in the game on Sunday, that may be their last game. They may need to go in and receive care, or they could have a critical head injury. So it's not, the old guys. It's just something that could be used today. What we are planning is that we would do screens on certainly all the retired players. This is something we want to do. We want to do some brain screens on all the current retired players. But we'd like to extend that to guys coming into the league so that we could have a database so we know what the situation is when they come in. And when they leave, we can test them again so we know if they've had brain damage or anything like that in terms of later repercussions.